Corporate Communication at the Ministry of Health, Candace Alcantara.
Good morning, Trinidad and Tobago, and thank you for joining us for another virtual conference hosted by the Ministry of Health as we talk to you about COVID-19 and COVID-19 vaccines. In studio with us today, I'm very pleased to welcome back the Honorable Terrence Dayal Singh, Minister of Health, Dr. Erica Wheeler, PAHO WHO Country Representative for Trinidad and Tobago and the Caribbean Dutch Territories, and Dr. Roshan Parashram, Chief Medical Officer. Many of you all are aware that yesterday, just at 6:10 p.m. as predicted, Trinidad and Tobago received the first major shipment of COVID-19 vaccines via the COVAX facility. So very, very exciting time for Trinidad and Tobago. But even as we have received the vaccines, we want to implore members of the public, please remember to follow all of the guidelines. If we work together, we will come through this together. Just a quick reminder about these guidelines. Wear your mask over your nose and mouth, please, when you go out in public. Keep your distance from others who are not in your household bubble. And wash your hands. And we go now to the Chief Medical Officer, who will deliver the clinical update and some additional information on the Astrazeneca COVID-19 vaccine.
Hi, good morning. Thanks, Ms. Alcantara. Good morning to the Honorable Minister, to Dr. Wheeler, members of the media, members of the viewing and listening public. So as is usual, we begin with the clinical update for March 30th, 2021. So the total number of tests conducted thus far at both private and public facilities now stand at 108,693. The new positives over the last 24 hours are reported as 18, now taking us over the 8,000 mark. So we have 8,004 positive cases since the 12th of March, 2020. Our total recovered patients are 7,608. Total active cases now stand at 254. Our total persons in home isolation of that group, 216. And those persons in hospital now stand at 16. The total persons in step down are at 4, and the total persons in state quarantine, 313. Breaking down the hospital patients, total of 16. 8 of those at the Couva Hospital and Multi-Training Facility. No one in ICU, no one in HDU. At the Cora facility, there are 5 persons, and at the Scarborough Regional Hospital at Fort King George, there are 3 persons. With regards to state quarantine facilities, there are Cara Suites, 32 persons, Cascadia Hotel, 8 persons, Chancellor Hotel, 8, Daybay Halls, 29, Homo Football, 28 persons, Capox, 77, Lorena B, 16, Napa, 10, Paria Suites, 18, Regent Star, 42, Tradewinds Hotel, 19. So if I can have my first slide. So what we'll be discussing a bit today, as you know, the first batch of vaccines we got is indeed the Astrazeneca vaccine from the South Korean plant. So we'll just give a little bit of detail about this vaccine in particular, some vaccine facts. So starting with the first slide, of course, is AstraZeneca Oxford vaccine is an adenovirus vectored vaccine. And a vector vaccine really is a vaccine that is transported via one virus into the human body, and of course represents a small portion of the virus, COVID-19 in this case, that we want to gain protection against. So the spike protein in this particular instance is utilized to create that immune response that we want, producing antibodies and memory cells that will be able to recognize the virus, so that if a person subsequently becomes infected with COVID-19, they already have antibodies that can protect them against this particular disease. Next slide. So it is recommended at this point that all vaccinated individuals receive 2 doses of the AstraZeneca vaccine, and the recommended schedule of dosing as of now from WHO, it's a 0.5 ml for each dose with an interval of 8 to 12 weeks. So just to give you a little history about the 8 to 12 weeks, as you would have recalled, the manufacturer of AstraZeneca in the early days of the epidemic, when they had just started to use AstraZeneca, recommended 21 to 28 days between the first and the second dose. Some countries, because of the way the epidemic was spreading, they wanted to have that first dose given to a larger portion of their population holding the second dose back a little while. And what happened is what they realized is having held the second dose, the efficacy would have gone up thereafter, giving the second dose between 8 and 12 weeks. And that's what we found in the phase 4 trials. WHO subsequently changed the recommendation for maximal efficacy to go between 8 and 12 weeks. And that's what we are using in Trinidad and Tobago at this point in time. Next slide. So there should be a minimum interval of 14 days between administration of this vaccine and any other vaccine against other conditions. Meaning if you would have had the, for example, influenza vaccine before, you have to wait at least 14 days before you have the first dose of this particular vaccine. This recommendation may be amended in the coming days or weeks based on, of course, clinical trials as it is ongoing. Next slide. Right, so it is currently recommended that the same product, meaning AstraZeneca, be used for the first and second dose, meaning not using the AstraZeneca for the first dose and, for example, the Pfizer vaccine for a second dose. However, it must be stated that WHO has given us guidance in terms of using the AstraZeneca vaccine from one particular manufacturing site and a second dose from another manufacturing site. So the SAGE group of WHO was asked that specific question in our weekly meetings with them last week, and they have indicated interchangeability in terms of one site. So, for example, we have received a South Korean manufacturing batch. If we give the second dose, for example, out of this Indian manufacturing site, there will be no issue at all with regards to the vaccine itself. Next slide. So when we look at some target groups and some contraindications, persons aged 18 years and over should receive the AstraZeneca vaccine in the first phase, and this is the recommendation coming out of WHO at this point. There are ongoing trials in the UK and other parts of the world with regards to going less than this age group. There's a trial with persons for this particular vaccine, 6 to 16 years of age. There is trials ongoing for other vaccines between 12 and 16 years of age. That includes the Pfizer vaccine and the Johnson & Johnson vaccines. When that data becomes available, we may amend this, but for now, Trinidad and Tobago is using 18 years and above to receive the vaccine. The WHO also recommends that vaccines for use in persons aged 65 years and over continue, and in alignment with that, Trinidad sets the lower limit of 18 years, and there's no upper limit in our vaccine schedule. Next slide. Those persons that should not get the AstraZeneca at this point, and again, the same point for now, persons less than 18 years of age, persons who are pregnant or breastfeeding, it's not recommended at this point in Trinidad and Tobago, persons with a history of anaphylaxis to any component of the vaccine, and persons who would have had an anaphylactic or allergic type reaction when they get the first dose of this particular vaccine. Next slide. Right. This slide relates to persons who would have had active infection with COVID-19 in Trinidad or any other part of the world. So once you confirmed as positive for COVID-19, the rule and WHO recommendation stands for now that persons should wait at least 6 months from the onset from a positive PCR test before you get vaccinated, and that's to ensure that the acute phase of the illness, as you know, there can be long COVID, and we want to ensure that the acute phase has passed before we vaccinate. Okay. I think that brings me to the end of the presentation this morning. Thank you, Ms. Alcantara, for the time.
Thank you very much, CMO. And as mentioned before, yesterday Trinidad and Tobago received a significant shipment of COVID-19 vaccines via the COVAX facility. And in that regard, we have Dr. Erica Wheeler here to deliver her presentation on this matter.
Good morning, Ms. Alcantara, Honorable Minister of Health, CMO, Dr. Parasram, members of the viewing and listening public. As you've just heard, we are in the very happy position that the revolving fund acting on the distribution of vaccines from the COVAX facility have sent the first tranche of the 100,800 doses to Trinidad and Tobago as planned before the end of March. Several other countries in the Caribbean have or already received vaccines, and others will be receiving vaccines in the coming months. The range is between 24,000 and, as we received it here in Trinidad and Tobago, 33,600. These would be sent in 3 tranches, or if it is possible to negotiate with the COVAX facility to get 2 tranches, but this will be over the period March, April, and May. So by the end of May, there should have been delivered 100,800 doses as promised from the COVAX facility with the South Korean Astrazeneca vaccines, as mentioned just now by Dr. Roshan Parasram. Other countries have been receiving the Serum Institute of India Astrazeneca vaccines, but these are what's called the advanced market commitment countries who are receiving these vaccines free of cost. But we are on track in Trinidad and Tobago to continue to receive on a 4-week rolling program the next doses of vaccines between now and May. By June, Johnson & Johnson vaccine should be available to the COVAX facility, and we know that currently there are other vaccines under consideration by WHO. Again, to reiterate that the manufacturers have to present an expression of interest to the WHO for emergency use listing before vaccines can be approved. Once they are approved by the assessors, and all of the stringent regulatory authorities have already approved those vaccines, then the final body, the global body to approve them, is WHO. In keeping with this, the government of Trinidad and Tobago has waited until AstraZeneca has been approved by WHO, and now we are in the favorable position that we have the first tranche of vaccines. We will continue through our revolving fund for vaccines, to procure vaccines on behalf of the people of Trinidad and Tobago, and continue to work very closely with the Ministry of Health on the rollout of the vaccines in the coming months. Thank you.
Thank you very much, Dr. Wheeler. And we're quite pleased to continue to work with PA, who has given quite a bit of support during this national response to COVID-19. And we return to Dr. Roshan Parasram, who has one additional piece of information to share with the public.
Hi, yes, thanks, Ms. Alcantara. So, after receiving the vaccines yesterday, it was taken to C40. What we found out, 2 things. So we look at the temperature excursions to see if there were any, and we're happy to say that this vaccine was kept between 2.1 and 2.3 degrees for the entire journey from its starting point all the way to Trinidad and Tobago and to C40. So it is in very good condition in terms of the temperature storage. Also, what we noted is that the expiry now says to us that the vaccine is due to expire on the 31st of May, 2021. Which from today's date gives us approximately 2 months or 8 weeks from the start of use to the end of use for the second dose. And in the discussion already I had cited, initially the manufacturer had said 21 to 28 days for the second dose, which we can achieve with this particular dose. However, the new WHO recommendation is 8 to 12 weeks. So what we will be doing is using the first half of the 16,000 doses, and determining basically if and when we're getting that second supply, and then we'll make a decision then as to if to use this 16,000 and hold for the second dose, or go ahead and use all 33,000 for our first dose, and of course they give the second dose when the other tranche of AstraZeneca comes in. So that is something that we will be deciding in the coming weeks once we get to 16,000 or half of the 33,000 of the first vaccine. Back to you, Candice.
Thank you very much, CMO, for that important update. And we go now to the Minister of Health, the Honorable Terrence Dayal Singh.
Thank you. Thank you very much, Candice. Good morning to Dr. Wheeler. And really thank you on behalf of the people, government, the Prime Minister, government, and people of Trinidad and Tobago for working so hard with us behind the scenes. I don't think anyone will know how we work behind the scenes, talking to Dr. Wheeler, with myself talking to Washington almost on a daily basis. And good morning to the Chief Medical Officer, ladies and gentlemen of the media, and Trinidad and Tobago. I know we are excited, as I am, about the receipt of the vaccines. I'm not going to go into the details. The Chief Medical Officer has already done so. I know we are excited so we can start our national rollout plan next week, Tuesday, the 6th of April. However, that excitement has to be tempered, and it is my job this morning, unfortunately, to temper that excitement by injecting, and I use the word injecting deliberately, pun intended, by injecting into our consciousness a sense of reality about where we are in this COVID-19 pandemic. There were some very unfortunate statements made in the Parliament last week, where some parliamentarians were referring to Trinidad and Tobago being in a post-pandemic state. Let me disabuse the public and everyone. We are not in a post-pandemic phase. We are in a global pandemic. And to emphasize that, because if we don't emphasize that, the subtle message going out to people who depend on their leaders for information is that we can relax. And as you have seen in the past few weeks, with the 7-day rolling average going up from 3 to 4 to 5, as Dr. Hines said on Saturday, I believe we are now at 17. So the rolling 7-day average has gone up by 500% in the past few weeks. So we are still in a pandemic. To emphasize that, I want to refer to a statement made by Dr. Rochelle Walensky, who is the head of U.S. public agency CDC. And she said, and this is it, what she is saying, she is warning of impending doom. This is not a statement from last month or last year. This is a statement made 1 day ago. Impending doom. The next statement I want to refer to is a statement carried in a newspaper on Monday, 29th March. This is 2 days ago. This is not 2 months ago. 2 days ago, where Dr. Carissa Etienne says, PAHO warns virus surging dangerously in the region, and we are in this region. And I just want to quote a couple paragraphs because it is important that we understand where we are. She says, the COVID-19 virus is not receding, nor is the pandemic starting to go away. Vaccines are coming, but they are still several months away for most people in our region. She is urging people to continue to respect the public health measures, masks, hand washing, social distancing, and so on. And she goes on to say, and this is key to the start of our vaccine rollout program. Although scale-up has begun, as we are going to start, we know it is not enough. This is not only happening in Trinidad and Tobago, but throughout the Americas, where Dr. Etienne is speaking about. We do not yet have the vaccines we need to protect everyone. And that is a key message. As we celebrate the receipt of 33,000 doses of vaccines, that celebration must be tempered by the reality, which is we are not in a position yet to relax. We are not in a position yet to say we have conquered the virus. We are going into a very difficult and dangerous week of relaxation, where people will be congregating in social settings and on beaches and in their homes and having functions in their homes. We at the Ministry of Health, and I want to reiterate what the Honorable Prime Minister said on Saturday, all leaders who have influence over people, the message has to be continue to uphold the public health measures, which we did brilliantly, but which we are now starting with COVID fatigue all around the world. I understand that, all around the world. We cannot relax now. The last piece of news I would like to share with the public, to tell the public that the government and the Ministry of Health will never expose this country to vaccines that are not WHO certified. And we have said on this platform that I, as your Minister of Health, will never sacrifice safety for expediency. There was another article in a same Monday 29th newspapers. I wouldn't show it because I don't want to name the country. It is there. But the headline goes like this: false COVID vaccine detected in, names the country. The country is irrelevant. What is important to us is that there are false vaccines circulating in the Americas. And it goes on to say it may still be in circulation in the Americas, and we are part of the Americas. The article says, falsified COVID-19 vaccines pose a serious risk to global public health and place an additional burden on vulnerable populations and health systems. It is important to identify and remove these from circulation. And it is important now that you get the details. The genuine manufacturer of COVID-19 vaccine, BNT 162B2, confirmed they did not manufacture that product. The batch number and expiry dates are falsified. The glass vials and labels are different from the COVID-19 vaccine BN2 162B2 vials. WHO requests increased vigilance with the supply in the supply chains of countries and regions likely to be affected by these falsified products. Increased vigilance should include hospitals, clinics, health centers, and this is the crucial part that I have been talking to the public about: wholesalers, distributors, and other suppliers of medical products. That is why we at the Ministry of Health have taken such a proactive stance in protecting the population from suppliers and distributors who claim to have access to vaccines. Falsified vaccines are in circulation in the Americas. As a last example to show you how easily a country can be duped into purchasing vaccines because some countries are desperate. One supplier reached out to me and said, "Minister, we have 110 million doses of Astrazeneca vaccine in an airport in Europe." I wouldn't call the name of the airport. Could you imagine that? In this era of shortage of vaccines, he is claiming he has access to 110 million doses of Astrazeneca vaccines lying down in an airport. Ladies and gentlemen, the Ministry of Health is going to be very, very careful. At this point in time, vaccine manufacturers are not even speaking to their authorized local distributors. And we will continue to protect the public's interests and only at this time bring in vaccines through the COVAX facility and through the bilateral talks that either the government via the Ministry of Foreign Affairs and or the Ministry of Health is having with either countries and or vaccine manufacturers. As I have said on this platform before, there will come a time, we don't know when vaccines will become commoditized. And then local distributors who are authorized by Astrazeneca, authorized by Pfizer, authorized by Johnson & Johnson, or any other manufacturer that gets WHO approval, that time will come. I can't give you an exact date. And at that time, we will be talking to authorized distributors or anyone else who is authorized to conduct business on behalf of vaccine manufacturers. So my 3 takeaways this morning: 1, yes, let's be happy we have received the vaccines. 2, the vaccines does not mean that we can relax. We have to continue our public health measures. And 3, we will continue to protect the lives and safety of all citizens by only bringing in WHO-approved vaccines from authorized sources. Thank you very much, and I hope this clarifies many issues.
Thank you very much, Minister Dayal Singh. And as we move into the question and answer segment of this conference, we ask our media representatives to indicate the name of the media house that they represent and their name before posing 2 brief questions, please. And please pose both questions at the same time. We begin with 98.1 this morning.
Good morning to you, Ms. Alcantara, Minister Dayal Singh, Dr. Wheeler, and the Chief Medical Officer, Dr. Parasram. Stephen Cummings here, 98.1 FM. My 2 questions quickly, one for Dr. Wheeler and the other for Minister Dayal Singh. I start with Dr. Wheeler. Dr. Wheeler, now that we have this current batch of vaccines, having regard to an environment that continues to change with rapidity, has there been any change as well, referencing the logistics and plans which were articulated by PAHO prior to this batch of vaccines we now have? And secondly, Minister, we are at a critical moment in healthcare delivery in Trinidad and Tobago, and there continues to be some rumblings regarding nurses at several of the RHAs. Can you give any assurance that there will not be any disruption, especially at this time with the vaccination rollout? I'm hearing of nurses expressing concerns through their registered association about conditions of work and the fact that we could have nurses or nurses' HR issue in the middle of a COVID-19 mitigation strategy. Thank you.
Thank you very much for your question. So to date, we do not have any changes in the logistics for the delivery of the Astrazeneca vaccine via the revolving fund of PAHO. I know that it is the Serum Institute of India. There's been a reduced quantity of vaccines for the advanced market commitment countries because India is now vaccinating persons 45 years and above rather than 65 years and above. So there has been a dip in the quantity of vaccines going to the advanced market commitment countries. But PAHO is still very much engaged in discussions with the COVAX facility. And to date, we still have the commitment of the 4-week rolling wave of delivery of vaccines up until May of the Astrazeneca vaccines coming out of Korea. Thank you.
Thank you, Mr. Cummins, for your question. I always run these issues via our National Director of Nursing, Nurse Betty Ann Pilgrim, and the CEOs. I meet with the CEOs tomorrow morning at 8:30, and I will surely raise the issue with them. Thank you very much.
Thank you very much, Minister. And now to IETV, please.
Hi, good morning, everyone. Bina Mahir from IETV. I have 2 quick questions, perhaps for Minister and Dr. Wheeler. Can we have an update on the 140,000 vaccines from India and China? When can we expect those vaccines to come in the country? As well as, Minister, can you suggest a timeline for the general population to be vaccinated? And my final question, are we prepared for a possible outbreak of COVID cases post the Easter vacation? Thank you.
Thank you. So you got in our third question there, Bina. Very good. So we have no timelines yet for the receipt of vaccines from India and China. What we have done is set up the team between Ministry of Foreign and CARICOM Affairs and Ministry of Health. India has indicated that they are in fact going to provide us with 40,000 doses. We continue to work with the embassy, and when we have timelines, again, we will alert all. The issue with China, as we said, once the Sinopharm and or Sinovac vaccine from China, manufactured in China, receives WHO approval. So far, all things being equal, we are looking at the end of April. We have already indicated to the Chinese embassy. I met with His Excellency and the ambassador on Monday. We have placed what is called an indicative order, and then once the WHO signs off on it, it turns from an indicative order into a factual order. As timeline, as you can appreciate, as we have always said, we can't give a timeline. I want to refer to what Dr. Etienne has said. Although scale-up has begun, we know it is not enough. We do not yet have the vaccines needed to protect everyone. This is a global problem. This is not a Trinidad and Tobago situation. I want to keep repeating that. The shortage of vaccines is a global problem. And I'm quoting Dr. Carissa Etienne. No country, very few countries in the world that depend on COVAX, and small countries like us that don't manufacture vaccines, or even larger countries, simply don't have the control over manufacturing sites. And the Americas is caught in that. So it is difficult to give you a date, a timeline. Once vaccines reaching in the numbers and the uptake is what we expect, then we could start to talk about timelines. But it'll be very difficult to give you a timeline now. Thank you.
And the question on the
Sorry.
increase due to the holiday season.
Yes. So we are prepared, but we don't want to say we are prepared and we fill up hospitals. What we want is to prevent. And that is why, from the Honorable Prime Minister, His Grace the Archbishop, the Commissioner of Police, are all asking people to conduct themselves in their social settings responsibly this weekend. So we don't have to utilize hospitals. Prevention is better than cure. An ounce of prevention is better than a pound of cure. Thank you very much.
Thank you, Minister. And we go now to Newsday, please. Are we ready for Newsday? Wonderful, Miss Mackenzie. We don't seem to be hearing Miss Mackenzie. I don't know if there's a...
Hi, good morning,
Wonderful.
everyone.
Good morning. We can hear you now.
Okay, good. Rihanna Mackenzie from Newsday here. Okay, so my first question, what is the process for booking an appointment if you qualify for the first phase of the rollout? Can frontline workers reach out to the ministry, or will the ministry contact them directly and make those arrangements? My second question, I was hoping Dr. Parasram could clarify this for me, the issues mentioned with anaphylaxis. Just to clarify, people with these issues cannot receive the vaccine, or those who have an anaphylactic reaction to the first dose will not receive the second dose. Can you clarify that for me? Thank you.
So I will take the first question first. As we did with the first 1,000 plus RHA workers don't contact the ministry. The RHAs, who are the employers of frontline healthcare workers, have already been in contact and are contacting as they go along healthcare workers to be vaccinated. So they don't come to the ministry. It is handled at the level of the RHAs, the 5 RHAs. So if you're a healthcare worker in North Central, there are communication channels for any healthcare worker in North Central RHA to be vaccinated. Similarly with Southwest, similarly with Northwest, similarly with Eastern, similarly with Tobago. And that's the process we have always used and that we use when we vaccinated the first 1,000 plus. They don't come to the ministry. It is handled at the level of the RHA. Thank you very much.
And we go now to CMO, please, for response to the second question on anaphylaxis.
Okay, so just to clarify, so an anaphylactic reaction is a severe type of allergic reaction. So for this particular vaccine, Astrazeneca, what we said is if you have an allergic reaction to the first dose, then of course we won't be able to give you that second dose of this particular vaccine. If you have known severe allergic reactions to any component of the vaccine, then of course we won't be giving this vaccine as well. That is something that is determined at the clinical assessment phase when you come in for your vaccination.
Thank you very much. And we go now to Wired 868, please.
Hi, good morning. Paola Bostic, Wired 868. My first question has to do with the 16,000 or so vaccines that we expect to distribute in the first instance. Could you tell us how long you expect that distribution to take and to what extent would it just go to the frontline workers or will it get to persons with NCDs and the elderly with that amount? That's my question. And my second question is what provisions are there, if any, for the elderly especially or other persons who may have mobility issues in terms of access to the vaccination sites? Okay. Will there be people going to them or would they have, or is there any way to assist?
Okay. So there was a question I just remembered that I think Bina had asked about the appointment system. So it dovetails with what you are asking. We will be ramping up from Tuesday within hopefully a week to start to vaccinate about 1,000 persons per day. It could be more, depending on acceptance and so on. So if we do 1,000 per day, that gives you the figure. The first 16,000 persons could be done within 2.5 weeks. So that is the kind of timelines that we are playing with. Appointment systems, in the coming 2 days, Candice,
should be.
You will be seeing in the newspapers, on social media, on our website, the phone numbers of the 21 sites to call for members of the public who are not in the NCD clinics, but who qualify by virtue of either age or NCDs to phone to make your appointment. It is going to be a strict appointment system in the first instance. So that is how it's going to work. With the issue of mobility, in this phase, going on WHO's recommendations because of what the CMO said about anaphylaxis, each recipient of a vaccine has to physically come to our site, be vaccinated, and be physically monitored for between 50 and 30 minutes.
Yes.
Is that? Yeah? 30 minutes. Just to ensure for that person's safety, they aren't suffering any adverse reactions. So in the first stage, and then when we get that body of knowledge, and we are comfortable that we can move further down and probably do mass vaccination sites in communities, in homes, we will do that then. But in the first instance, we want to collect as much data as possible to show and demonstrate that anaphylaxis, however rare, we have it managed in a facility where the person can be resuscitated in the unlikely event that you have an adverse event. Okay? So I don't know if the CMO wants to add any more technical information there.
Candice, that's okay.
Okay.
Good. Okay, good. So CMO said that Minister has answered everything clearly. And we go now to Wired 868, please. Oh, my apologies. AZP News. We just had Wired 868. AZP News, please.
Hi, good morning. Prabhi Hari, AZPnews.com. Minister, I just wanted to take you back to that issue about 1,000 people per day who have to wait at least half an hour. Do we have the facilities? Because that means if you look at an 8-hour day, we would have to keep 125 people an hour at least there, at that facilities. I mean, that seems a lot of people, to be at these health centers. I don't know if there are the proper things are being put in place for that. And my second question has to do, I'm a bit concerned about the expiry date of these vaccines at the end of May, because if someone gets the vaccine starting on Tuesday, which is 6th of April, 8 weeks from that, it takes us into June. So is it that some of the options available is that we may give them, we get the vaccine before the 8 weeks, or is it after the 12 weeks? And what will be the effectiveness of this? Have there been any studies done saying that if we got the second dose before the 8 weeks, or if we get it when the vaccine expired, if there's any issues with the efficacy of that?
Okay,
Thank you.
Thank you, Prior. I believe the CMO had volunteered the information that you were asked in your second question. I will ask him to repeat it. I will address your first question. Prior, we are doing 1,000 doses. Yes, it may sound like a lot, but please remember it's distributed amongst 21 sites. So that is roughly 50 per day in 21 sites. So yes, we have chosen these 21 sites very carefully. And that is why we didn't go to all the health centers. We have chosen the 21 sites that are very capable of treating any case of anaphylaxis. Okay, so I hope that comforts you. And I will ask the CMO to repeat what he said to answer your second question.
Okay, so basically what you're saying is correct. So given the 31st of May being our expiry, and we're supposed to start on the 6th of April, we basically at best have about 7 weeks with that first dose. Remembering what the manufacturer had put out early on is that their second dose should have been given 21 to 28 days after the first dose. And of course, what we found now in terms of the research, after you have your first dose of this particular vaccine, you roughly have about 76% protection with one single dose. That goes up to somewhere about 82, 84% with a second dose given up to manufacturing specifications, meaning 21 to 28 days apart. The studies have shown thereafter that if you go closer to 12 weeks, you're getting into the 90s. So it is not a very large drop in efficacy, but maximal efficacy will be getting closer to that 12-week interval, and that's what we will aim for. But again, it's available, depends on the delivery of that second tranche of AstraZeneca, and I will make that decision in the coming weeks when we get to the halfway point, which is just over 16,000 vaccines, as to whether we are going to give that second dose with this first tranche, or to give it with the second tranche that we receive thereafter. Hope that clarifies.
Thank you, CMO. And now to Express newspaper, please.
Good morning, Camille Hunt, Express. Minister Dayal Singh, there are more reports of countries halting use of the AstraZeneca vaccine. Canada and Germany have now suspended it for people under the age of 60. So my question is, are we confident going forward with our vaccination rollout as planned, even as other countries are raising these concerns? And to what extent do we look at what is happening in other countries to guide us in our response?
Sure, thank you. So we always look at the experience in other countries, and we look at it dispassionately without any degree of panic. You may remember there were some cases of blood clots in the elderly in Europe that temporarily halted their program, and we said we will look at the data. The data came back and said there was no link. But we always monitor these things to make sure that our policies are in line with scientific evidence. I will now turn over to Dr. Wheeler, who can give you some more information on that particular issue.
Okay, thank you, Mr. Minister. Well, certainly the position of WHO is that countries should continue to vaccinate their population, because the evidence so far does not show that there is any clinical link or there's any death related to the current vaccines. Of course, countries are sovereign, the governments are sovereign, and therefore they can make decisions based on whatever their political issues are. But if we look at the science, there is nothing that says that there should not continue to be vaccination using Astrazeneca vaccine. And I think we need always to be careful. And yes, it is very easy to digest misinformation. And of course, people are suspicious that the vaccines were produced too quickly. But please remember that when WHO gives an emergency use listing, it's usually on the basis of several other what we call stringent regulatory authorities also approving the use of the vaccine, like in the USA, FDA, in Canada, in the UK, and then in Europe, the European Medicines Agency. And then all the assessment is done by teams globally to come up with recommendations. And there's also a committee called SAGE, which looks at the global advisory on vaccination and immunization. So to date, we have not received any clinical scientific information that says that will cause countries to stop vaccinating the population. Our position is that we want to preserve life. We want to stop persons from becoming ill, from being hospitalized, overwhelming the health system, and of course we want to stop people from dying. So therefore, as far as the WHO position is concerned, we still want to encourage countries to continue to vaccinate their population. Should any other evidence at any point in time become available, of course it would be shared, but to date, there is nothing which suggests that there's any scientific basis for the halting of vaccination. Thank you.
Thank you, Dr. Wheeler. And we go now to TV6 News, please. We're ready for you, Ms. Cutting.
Good morning, TV6 News. To the Minister of Health, I'd like to know when the Prime Minister and Jagruti Self and other cabinet colleagues will be inoculated, whether all persons have indicated a willingness to do so, and also whether an invitation will be extended to the members opposite to have them vaccinated as well.
That's it? Okay. So as we have said publicly again, and it's worth repeating, so thank you for asking, I will be coordinating. The Prime Minister did say on Saturday at his press conference he will be vaccinated on Tuesday in Tobago. He has said so publicly. I will also be vaccinated publicly on Tuesday again. A press release will go out telling the media when and where. So that is myself as Minister of Health. As a healthcare worker, you would remember a couple of months ago, Dr. Parasram did say I qualified on several bases. 1, age, 2, comorbidities, and 3, I'm a healthcare worker. Okay, let's go to other parliamentarians. Let me remind what I have been saying all along. Phase 1, healthcare workers, people over 60 with NCDs. We'll get them through first. Phase 2, essential frontline workers. In essential frontline workers, that will be persons, frontline police, frontline defense force, frontline prison officers, and so on. Included in that, in phase 2, when the other vaccines come in, will be persons like local government practitioners and members of parliament and so on. So as we stand now, the general parliamentary caucuses on both sides and the Senate will have to wait on phase 2. These initial 33,000 doses are reserved based on COVAX's principle of equity, high risk, high exposure to healthcare workers and persons with NCDs. But again, as we said, the Prime Minister as a leader will be vaccinated on Tuesday, and I, as Minister of Health, will be vaccinated on Tuesday, as we had promised when we got in the initial 2,000 doses. So thank you for the question, Renessa.
Thank you very much, Minister. And a follow-up question now from 98.1.
Thank you again, Ms. Alcantara. My question, I'm going to Minister Dayal Singh. Minister, I know that the Minister of Foreign Affairs is not here, but you know, I'm also wondering if this is a fair question, you know, posed to you. But I'll pose it anyway. There is a continuous narrative by some critics that government would have been slow on the side of diplomacy when it comes to early vaccine access negotiations with key manufacturers and even governments, leading to what some have deemed the country being left at the back of the line of several of our close CARICOM neighbors regarding vaccines access. Is that a fair criticism, you think, or would you still defend the timeline and route taken by government that brought us to this stage? Thank you.
Thank you. So as we have said time and time again in response to those questions, the Ministry of Health started bilateral talks since October the 1st of 2020. It is not only a request from us, you also have to wait until the other side is willing to speak to you. So we had bilateral talks with Sinopharm. I believe that was the first country manufacturer since October the 1st, 2020. We started to talk to Pfizer. We started to talk to Astrazeneca. We started to talk to Johnson & Johnson. The Honorable Prime Minister a couple of weeks ago at the conversations put on the public record the issue of India. It is not for me to get into that. Since that, tremendous strides have been made. The government and people of India continue to work collaboratively as the government of people of Trinidad, Tobago and China. So there's nothing to defend. There was no error. We were very proactive since October 1st. And let me go beyond that. October 1st was when the formal talk started. But before people are willing to speak to you, we were making approaches since August and September, asking people to speak to us, and then formal negotiations. Our first talk was with the government of China. So we have been working assiduously to get vaccines that are WHO approved into Trinidad and Tobago. And let me say, the Astrazeneca vaccine only got WHO approval on February 15th of 2021. We need to understand those timelines. We need to understand that our policy, as opposed to of other sovereign nations who are free to use non-WHO approved vaccines, they are free to do that. But our policy has always been to use WHO approved vaccines. AstraZeneca only got on February 15th. Johnson & Johnson only got it, Erica, about recently. And Pfizer, if you remember, Pfizer was not even a part of COVAX until the end of January 2021.
Yeah, on December the 31st.
Yeah,
The official
on December the 31st. So those are some of the hurdles that we have to cross in order to bring into country vaccines that are safe and effective. And again, I want to repeat, we will not sacrifice safety for expediency. So thank you very much, Mr. Cummins.
Thank you very much. And now, Wired 868, we're ready for your additional question, please.
Hi, good morning again. Quick question. This is concerning the the private sector health that the Ministry of Health received. Last week, I think we sent out a communication that 46 companies had received letters of thanks from the Ministry of Health for the support that they had voluntarily given to the government in its response to COVID-19. Could you tell us a little bit more about what type of help specifically the private sector has been giving, and whether or not that has to do with vaccine procurement as well.
Okay, thank you. So those letters went out to thank companies and organizations that helped us in 2020. I was at pains to say that. It has nothing to do with vaccines. Some organizations provided sanitizers. So if like Angostura would have provided sanitizer. Some companies provided face masks. Some companies provided basic furniture. Some companies provided food for healthcare workers. Some companies, the Syrian Lebanese Association, provided meals for the Ministry of Health. Some companies provided basic things like everybody wanted to assist in 2020. Some companies donated ventilators. Some companies donated basic hospital equipment. So those letters that went out were to thank people who contributed towards the effort in 2020. Okay, so I hope that clears it up. Thank you very much.
Thank you very much, Minister. Follow-up question from AZP News now, please.
Hi, good morning again, Prior here, AZP News. Minister, I'm getting a lot of questions about the appointment system. People want to know if they have an NCD, for example, do they call their health center and make an appointment? And also, I think there was talk of an online appointment system. Is that also in place? Can you just clarify that, or would it be contacted, or should they call the health center if they are part of the vulnerable group?
Okay, so thank you for the question again, and it's again worth repeating. We will be publishing within the next 2 days. The list of the health centers is already out. So persons in the communities already know the health centers. We will be publishing within the next 2 days the telephone numbers of the health centers where persons can phone in. And yes, there is an online system. So we're trying to make it as easy as possible for those who use the technology and for those who don't use the technology. But this is going to be local to communities. You can even walk in and make your appointment to come in on non-clinic days if you're a member of the general public. So thank you for the question.
Thank you very much, everyone, for participating. We have come to the end of today's virtual media conference. And everyone, we have come such a long way in the COVID-19 response. Because of our collective efforts, it's challenging, but please let's motivate ourselves and each other to remain vigilant. Even though we've received this significant number of vaccine, we must all still wash our hands, watch our distance from others, and of course wear our mask. We end with a video montage of the arrival of vaccines yesterday evening.
the hardness of hearts and the rebellion against God, God was persistent in his love for his people, and God's love never died.
Join TTT and TTT Live Online Facebook this Holy Week, March 28th to April 4th, for special services on Palm Sunday.